of times when we refer to metabolic health, we're referring to the choices that we're making to make sure that like our glucose level is stable and in a healthy range in order to minimize the large swings that we see in glucose throughout the day. And this isn't just about the food, right? So there's a lot of things that go into metabolic health that I think a lot of people don't think about. Stress, sleep, exercise, how your body is processing glucose, and like your genetic like predisposition towards glucose as well, and the environment that you're around. All of these things play a role in your metabolic health.
Hey everyone, welcome to this week's episode of Como Somos, where we talk to Rima Patel, who has worked and studied in medicine both in the US and Mexico. Rima has her super unique perspective on metabolic health, which is being informed by different cultures. She has also spent some time working in Silicon Valley with different health tech startups. So that allows her to kind of look at the bigger trends and major opportunities in healthcare. Today we chat about everything metabolic health, what the panorama in Mexico looks like for metabolic health, and why continuous glucose monitors are actually useful for almost everyone. We also dive into her personal story within her family of using continuous glucose monitors, and just a lot of incredible insights that Rima shares with us today. Rima, thank you so much for coming on the podcast today, and welcome to Como Somos.
Yeah, thank you for having me on. I'm super excited to be here today to just talk about, all things sort of health and metabolic health.
I would love to get into your background. So a question that I usually ask to break the ice is, what motivated you to study medicine, or why did you choose that career path?
I've always been passionate about medicine. My dad is actually a family physician. He actually trained in India and then came over to the United States and then has been practicing medicine for over 30 years. And seeing him and my mom build a clinic from ground up, I sort of got like my inklings of inspiration for medicine. I think I would spend like my entire childhood just sort of sitting in their clinic as they're building it up, and just being able to be a part of a person's health journey and how important it is to sort of have that healthcare providers like almost like an anchor for someone's life and being able to sort of guide you through the healthcare choices. And then as I went to college, I decided that I sort of wanted to get like a global sort of perspective on healthcare in general. And so I studied healthcare policy to understand sort of like the nuances between how healthcare is actually delivered. I think it's important as a practitioner not only to understand how you can serve the population, but sort of like what policies and guidelines affect healthcare, because a lot of the policies and guidelines that we have in place actually play a larger role in the community and for how healthcare is delivered to the population. And so that's why I got my master's in health policy. And then I decided, I wanted to get even larger sort of global perspective of medicine. And I always found it incredibly fascinating that the Mexican culture is very similar to the Indian culture in terms of the large emphasis placed on like community and, food and all of that. And so I decided, especially because such a large percentage of the US population is Hispanic, you're starting to see that they are the largest represented demographic after Caucasian. So I think it's really important to sort of get a global perspective of healthcare. And so that's why I studied UAG, Universidad Autónoma de Guadalajara, to get a further sort of perspective on what medicine is like in Mexico.
So that is incredible. And so when you were in Guadalajara, I'd be so curious to get because you're in the US right now, I'd be curious to get your opinion on what you learned there and kind of how you're excited for the future of healthcare in Mexico.
Yeah, so I think my experience was truly remarkable. I think a lot of people, at least from the US perspective, or even from the global perspective, they don't realize how amazing medicine is in other countries. And I got to experience that firsthand. During my time in Mexico, I actually discovered that because there's certain healthcare conditions that are more prevalent in Mexico, you actually have leading experts in Mexico that advise US doctors on certain things. So for example, parasites are really, really common in Mexico. You don't see them as often in the United States. So I've actually been in situations where we're in the hospital in Mexico and there's an infectious disease doctor and someone from the US actually calls them to ask them about, parasites or how to treat tuberculosis. And so I thought that was really interesting. Another thing that I found really fascinating about how healthcare is delivered in Mexico is the amount of time that the provider actually spends with the patient. In the US, you're incredibly rushed through sort of like the healthcare and the healthcare exams, and it's, not as personalized as I feel healthcare is delivered in Mexico. You still see people have a relationship with their providers, and you sort of get this like community feel. It's actually interesting because a lot of the Hispanic population in the United States actually still prefers to go to doctors in Mexico because they're sort of missing that, that touch. And a lot of people do find healthcare better delivered by people that represent them, that look like them, and that are able to speak their language. And I think that was incredible to see. And I think as the world becomes more globalized and more Mexicans are coming to the US and more US Americans are also settling in Mexico, as we're starting to see like retiring in Mexico, I think it's important to have sort of like a cross-cultural exchange of information because there's so many different topics in healthcare, and being able to sort of see them from different lens and angles and seeing the data from different populations, we're starting to realize that that's more and more important in healthcare. At least, the way that healthcare has been largely focused, we sort of taken, the male Caucasian perspective and making the diagnostic markers and quote unquote considering them a global standard. But we're starting to see that different populations have different sort of like markers for health. And it's important to realize the differences between those things. And I think we're starting to recognize in the United States. And so I think the healthcare information that we're going to be getting from Mexico, especially with all the data, is going to be incredibly valuable for our population as well.
Yeah, your experience is so valuable in that you saw both worlds. And I was reading, I think the stat was primary care spends on average 7 minutes in an appointment, which was, I think, much less than in Mexico. Yeah, and I would love to dive in with you today about metabolic health, specifically, just with the experience that you have working in Mexico and in the US. So metabolic health, like what do we mean by that? A stat that's often thrown around is that only 1 in 10 people are metabolically healthy. I would love to talk about the numbers of what metabolic health actually means.
Yeah, for sure. So I think maybe we can start with like a soft definition of like what metabolic health is. And so I think it's based on like metabolism, right? Which is a set of cellular mechanisms that produce energia for our comida and like the environment to power every process in the body. And this is basically a term that we use in general to describe how we generate and process the energy in your body. And one of the top things that we sort of use to measure the energy in the body is glucose, right? And that needs to be tightly regulated by your metabolism to work properly in the human body, right? And so it's basically a lot of times when we refer to metabolic health, we're referring to the choices that we're sort of making to make sure that like our glucose level is stable and in a healthy range in order to minimize the large swings that we see in glucose throughout the day. And this isn't just about the food, right? So there's a lot of things that sort of go into metabolic health that I think a lot of people don't think about. Stress, sleep, exercise, how your body is processing glucose and like your genetic sort of like predisposition towards glucose as well, and the environment that you're around. All of these things play a role in your metabolic health. And so you might wonder, like, why do I care about metabolic health? What does this even like mean? Is it really important? And I would say yes, right? Because metabolic health affects your energy levels, your sleep levels, how well you're able to function. And, what's surprising is one of the leading causes of disability is, having poor metabolic health. And I think we'll go further into sort of like the main precursor of metabolic health, which is glucose, and why it's so important to maintain these glucose levels. Diabetes is usually the leading or the second leading cause of death in Mexico. What's interesting is that as young as 2 years old, you can actually start to see the predisposition for diabetes amongst the Mexican population. And that's very concerning. And so most Mexicans do have a genetic predisposition. So what are extra measures that we can take in order to help our health and the glucose stay stable so that we don't end up with, a lot of these other healthcare conditions that can be controlled? Because once you're diagnosed with diabetes, you might have eye problems. kidney problems. There's also something called diabetic foot, where your foot has to be amputated if your glucose levels are too high and you end up being diagnosed with diabetes. And I think a lot of people don't realize this until it starts to become really serious. And you have to start making these changes early on in life. And as well, it's never too late to start. And so I think that's what we're trying to do. It's almost here is being able to sort of bring in these preventive measures and give you that data to sort of understand how you can fix your choices on like a daily basis to make an impact.
Yeah, and I feel that now there's much more awareness than there was before. So this crash after we eat something mal del puerco, that's not how your physiology should respond. So I feel that as we start talking about it, there's more awareness, and with more awareness, we can kind of look at more preventative things. So yeah, I would love to also dive into glucose monitors. You mentioned glucose as being like a hugely important indicator. What is your experience with glucose monitors? Are you excited about using them in the clinical practice? Do they have a lot of potential?
Yeah, for sure. So the way that we used to measure glucose is that there's just a standard test that you go in maybe once a year, maybe not. I know a lot of people don't want to see the doctor, and they would basically like take your blood and you would get a reading on something called your hemoglobin A1C. And that would sort of give you a momentary snapshot of like how your glucose is doing over time. But I don't feel like that's necessarily the best sort of representation of your glucose on a day-to-day basis. And so I think what continuous glucose monitors allow and what the research studies show is that it gives you sort of real-time data on what your body is doing in terms of glucose. And I think it's mainly been used in the diabetic population, but now we're starting to be able to see the impact that it can have on people that are not diabetic and can help them sort of prevent, getting into sort of the pre-diabetic and diabetic ranges. So I think basically what the literature shows is that for healthy individuals that are wearing a continuous glucose monitor, you want to make sure that your fasting glucose is between 72 to 85 and a post-meal glucose level of 110 or lower, and an average glucose less than 100, right? That's the most sort of important metrics for someone that's not diabetic. And basically what the research has shown is that throughout like a 24-hour cycle for someone that's healthy and non-diabetic, you want to make sure that your glucose ranges sort of stay in a certain range. And I will say that I have personal experience seeing how incredible a continuous glucose monitor can be. My family has a huge predisposition to diabetes on my father's side. My grandpa, my grandma, my dad, they've all had diabetes. Obviously, there was a genetic predisposition, but at the same time, the choices that they were making on a daily basis sort of were impacting their blood sugar levels. So I think a few years ago, my dad started wearing a continuous glucose monitor, and we were actually able to see in real time what things were actually causing the spike, right? Because for some people, maybe you eat a taco, right? And the taco is causing the spike. And so you can see, hey, maybe next time when I eat the taco, I should put less pork in it, or maybe I should put less sauce in it, just to see like the differences that your body is sort of capturing. And having that feedback for yourself in real time makes a difference, right? Because you go into the doctor's office, once a year and you see the number and it doesn't really mean anything, right? And you don't know, like, okay, the doctor might say, okay, like eat less tortillas or eat less tacos or drink one less Coca-Cola, right? But you're not seeing the day-to-day impact. And I think when you get that glucose monitor in your hand, you're able to see, oh my God, one Coca-Cola and my blood sugar has spiked so much. Usually I drink 5 a day. Imagine what that's doing to my sugar levels. And being able to have that feedback in real time has shown in studies that people will make correctional choices. I think it's beneficial not just for people that are diabetic, but also for people that aren't diabetic to sort of map out like, okay, maybe these foods are causing these things and I am starting to notice something about my energy. Let me see if I can fix this and see what happens. And for people that aren't diabetic, maybe it's not so much on the focus of the numbers, but more so on trying to correct your eating pattern and understanding what you can do on a daily basis. And sometimes you might not even be eating something, right? Maybe you're getting bad sleep. Maybe you're not exercising. And so all these things, being able to map out all these indicators, you'll be able to see that in real time and have that data with you. And I'm hoping that in the future, you're sort of able to have a personal graph of your data and be able to see, the different things with your life and sort of track, pinpoint, maybe this is when my health deteriorated, and go back and have that information for your doctors or your providers for them to understand a complete picture of your health. And I think we're going to start seeing that as we sort of progress further. And I will say, as a personal story, I think, diabetes is an extremely, extremely hard disease to have. I think it's become so common that we don't think about it as much, but there's so many impacts that it can have on your health. And it's not just diabetes, right? You can end up having so many other things. Cardiovascular conditions are linked to having high glucose levels, Alzheimer's. There's just so many different things that this can sort of help with. And having seen a family member be able to make their choices in real time, be able to reduce their metformin medication because having this tool allowed them to sort of have a personal coach for them in understanding the patterns. That's not to say that you don't do anything. It's not like you just put on the glucose monitor and then you're forget about it and not actually make choices. It's for you to use as a tool. Again, you don't want to obsess over it. You don't want to get super caught up on the numbers, right? It's really about making those sort of large lifestyle changes that are sustainable over the long time. And so you also want to not fall into the trap of micromanaging your numbers, because that's also unhealthy, right? In a different sense. And so we're not trying to get to the lowest glucose levels. You do need a certain amount of glucose to be able to have energy throughout the day.
That's so incredible, that story. And I love hearing personal stories that kind of experience the impact of these devices firsthand. I'm curious, what were some of the big takeaways, at least in your family's case, in terms of behavior change or even outside of food, about exercise or anything else, any new habits?
Yeah, for sure. I think, not just seeing the food pattern, but realizing that, for example, when he didn't sleep enough, right, he'll start to see that his glucose monitor would be showing higher levels and spikes in sugar, making sure that you're framing your activities in a certain way, having exercise, all of these things, he was sort of able to make incremental, small behavior changes, right? It doesn't happen overnight where you sort of come across and make this change, right? Over time and over a long period of time. So I would say a few months, and then we sort of got to see, we made these changes. Okay, over 6 months, we made these changes. Over a year, we made these changes. And it's different for everyone, but for him in particular, he was able to sort of reduce the dosage that he was on with his medication, because at the end of the day, there are certain things that can help sort of bring down your levels. And so I think that was really important for us to see. And another thing is, it also helped us as a family member see these foods or these things are, playing a certain role. And so making sure that when we made food at home or when we were going to exercise, we sort of included him in our activities. And so I think something that everyone can take away is that it's a team, right? It's not just an individual, but you can also provide sort of a community and support for those in your life that maybe have diabetes, or even if you don't have diabetes. I personally actually think that it can play. I haven't tried it right now, but I think I'm going to be trying, hopefully, Somos, and being able to see that real-time pattern mapping as someone that's, in the medical field. And, I'm always, lacking on sleep and, maybe not eating the best. And so I want to be able to sort of track those real-time changes.
And talking about what the numbers were, with these glucose spikes, the science kind of indicates that we should minimize the spikes, not having drastic spikes throughout the whole day. I wonder for people that are not necessarily diabetic, what do those peaks actually mean? Why would we want to kind of minimize them? What is the science kind of suggesting that, for long-term, either longevity reasons or oxidative stress, or kind of what is the reasoning behind that?
Yeah, so I think the reason that you want to be able to maintain, I think there's a lot of different types of indications that you can start to have, right, with your health. And so as you start to see the spikes, you can start to see things like fatigue, brain fog, depression, anxiety, lack of like energy. And there's also other things that you start to see like infertility, balding, acne, chronic pain. There's just so many different disease processes that are sort of associated. There's research being done every day that's coming out and sort of showing so many different factors are being impacted by, having higher levels of glucose.
And I'm curious, when kind of your family was going through this, did you end up changing like the order of the foods or certain types of foods? For example, eating like fiber or proteins and fats before the carbs, even like small changes?
Yeah, I think the big indication that we actually saw is that breads and grains were causing a larger sort of spike. And so changing out your processed breads for something simple like rice made a big difference. Being able to switch to things like quinoa, lentils, instead of using, the common sort of things that you always sort of gravitate towards, right? Packaged foods, those are probably most likely not going to help in terms of your healthcare. So making sure that you're doing fresh foods, incorporating sort of more vegetables, incorporating different choices within your food choices. And that's not to say that you can't eat Mexican food that you enjoy. I, being of Indian origin, like a lot of the things that we had were Indian. And I think now we're starting to see there has been more nutrition labels coming out in Mexico to sort of see like the breakdown of things that are in your food. And you can make the food that you have in a healthier manner, like maybe reducing the amount of oil that you're using alternatives to things that you traditionally use within your kitchen. I think that's important to think about.
Incredible. And outside of the glucose monitor, talking more broadly about using wearables, what else are you excited about in terms of these devices? So the technology allows us to track glucose today, but we see a future where we're tracking all sorts of things in real time. So what in that space are you excited about?
Yeah, I think that the one that I'm really watching and looking at is Whoop. They're working with a lot of athletes, and they're sort of focusing on digital fitness and using like health coaches, and we saw a partnership with the NBA and starting to see what it does for athletes. Another one that I'm really excited about, and the research is still sort of new on this, is continuous monitoring for cortisol. I think that will also be interesting to see what comes up in the research, because that impacts a lot of things that we do during the day. And, cortisol levels have been mapped to certain health conditions. Another thing that I want to see in wearables, especially for women's health, is different sort of like metrics, if we're able to in the future during times like your period, or being able to track things towards health. And so I think we're starting to see, I haven't seen anything that's like completely confirmed, but we're starting to see research being done in these different categories. And of course, I think the big one is what the Apple Watch has sort of done with monitoring your being able to see your heart health. And that's been shown now that people are actually able to see with this watch on your wrist, seeing the events of cardiovascular impacts of your health. And they've been going into the doctor, and once they see something on their Apple Watch. And I think that's incredible that now, in a time where there's not enough doctors, there's so much wait time in healthcare, being able to have these devices with you and having something 24/7 sort of map out your healthcare is going to be so fascinating. And having individualized data, right, for personalized medicine, I think that's going to play a big factor, because all of us are so, we have so many little things that are so different that we haven't thought about in healthcare. And these small little factors do make a difference. And so I'm incredibly excited to sort of see like where the wearables go and how they help us not only collect data, but to understand how different people react to not just their environment, but their food choices and, their health and, their community that they have around them.
And with these devices, do you see a trend happening towards more preventative care that consumers are kind of driving, saying like, okay, I see this data, I want to take action? Or do you see that happening in practice?
Yeah, a huge amount. The traditional medical curriculum in the United States actually did not include a lot of things about preventive, right? And we're starting to see, and I think this was more common in the Eastern cultures, that food is medicine, right? We're starting to see more courses on nutrition, we're starting to see a larger uptake of doctors joining the American Organization for Preventive Medicine, and more physicians sort of take these preventive medicine boards. And I think it really is driven by a large consumer push. Once we sort of saw like the foray of like the Apple Watch, and then we started seeing a whole bunch of other devices come out, and we're starting to see that, the average consumer is now super interested about their health. They want to take charge. They don't just want to go to the doctor, once a year and be told, okay, like do these things. Now they want to have, the ability to control their healthcare. And I think for when it's exploding and we do have that information, and it's starting to become more prevalent, so that we can actually practice medicine as sort of a team. And so I think medical curriculum is also going to change to place a larger emphasis on preventive health, because the amount of expense that we spend globally on healthcare, because it's too late, right? By the time someone has late stage diabetes, you've already have 5 other health conditions that are associated with it. Why not take a more active part on the preventive aspect? And I think more governments are starting to realize that too, is that, if we were to solve this problem earlier and be able to provide our population with better food and, exercise and be able to promote these things, I think we're going to end up with a healthier population in the long term.
Yeah, I think the stat is less than 10% of U.S. healthcare spend goes to preventative care, but I think we're going to see an uptake in that in the coming years.
I'm super excited about what Somos is doing, and I think we're going to, I really want to see what ends up happening in the population that we're looking for. And as more information and data comes out, I want people to have, that education at their fingertips. And it's really fascinating to see the push of digital health, especially in Mexico and the Latin and Hispanic population. And so I'm excited to see the future of healthcare.
We've kind of talked about why Mexico is exciting. Kind of on the flip side of that, is there anything that might stand out to you as challenges in Mexico that in other parts of the world might not exist? Just hurdles or anything that might be challenging in building better healthcare services?
Yeah, I think Mexico is an incredible sort of emerging market. And so I think some of the things that have been a larger problem is being able to sort of target the population that might be in more underserved areas. So I think the urban centers in Mexico, so Guadalajara, Mexico City, even Monterrey, they have such a robust sort of healthcare system built in. However, some of the places that more on the outskirts or the territories, it's hard to sort of for those people to access healthcare. I do think that digital medicine and better internet connection, more access smartphones will be able to deliver healthcare to those regions, but they've been notoriously underserved. I think another problem that's sort of faced is that sometimes the way that healthcare is delivered, they might not necessarily be able to get the most evidence-based medicine in certain parts because the sort of standardization, or they just don't have access to a trained or qualified nutritionist or a healthcare practitioner. And so I think that's another concern. And one of the other things that I think is concerning in terms of the Mexican healthcare system is that we are starting to see sort of a lot of the doctors be dissatisfied with the healthcare system in general. And so I think that's a global problem. I don't think that's a Mexico specific problem, but I do think that being able to have a sort of a more sustainable system in terms of healthcare workers, and then having a whole support system around it is really important. It's not just about, having the physician, but being able to empower community members and other people to sort of provide these services so that your resources go further, right? I think there's a huge lack in terms of the resources and distribution of how healthcare information is sent around Mexico. And so I think that's something to really look forward to in the future.
Yeah, I think there's a lot of opportunities there as well.
Yeah, sure.
And to close off the conversation, Rima, we have a lightning round, which is just a bunch of questions that we ask all of our guests. So if that's okay with you, we'll close out with that. And the first question is book recommendations. So what are your favorite books?
Mm-hmm. I think a great book to read is The Blood Sugar Solution by Dr. Mark Heyman, I believe. That's a great one because it provides sort of an overview of the epidemic of diabetes and offers sort of practical advice for losing weight and preventing these through healthy metabolic living.
Amazing. Yeah, he's got a bunch of books. His last one on longevity is really good as well. And who do you admire in the field that maybe we should interview?
Yeah, I think he would be. I would think he would be a great person to interview, and then I believe that that person would be great. I actually pulled up, I think, the second trained Hispanic woman doctor in the United States in Texas that works for NASA now. I thought that would be a good person.
You'll have to pass me her name after. This is my favorite question in the lightning round about overvalued and undervalued health topics. In social media, we're bombarded with information. What for you is like a really undervalued topic that we probably don't spend enough time on?
Yeah, so I think an undervalued topic is like ethnic biases in medicine. I think that's a hugely undervalued topic. Just like different populations have such different sort of like measures on certain health metrics. Even for women, I think, we don't focus as much on that. I do think that we'll start to see more of that happening, but I think that's very, very undervalued on social media right now.
That's interesting. And if I can ask a follow-up question, you mentioned how in our lab results, we kind of have these ranges. Do you mean like personalizing ranges based on that, like based on different profiles?
Yeah, at least in the United States, a lot of the standards and measures that we use for healthcare have been based on the Caucasian male. And we're starting to see that different populations actually have sort of different like levels and measures for certain markers that we use in healthcare. And we're starting to realize the importance of being able to do studies on these different populations to get a more accurate read on certain numbers and ranges within healthcare. And something that's, interesting and related to this conversation is that so many populations actually have a genetic predisposition to diabetes. So the Hispanic population, the South Asian population, Native American population, there are genetic predispositions that we have towards diabetes that Caucasian Americans might not. And so being able to really account for these factors within healthcare is going to be, I think, a big change that we're going to need to make. And I think one of the things that we need to do is include more Hispanics and Latin Americans in clinical trials for certain drugs and medications that we do and for making standards for health measurements. And I think having this personalized data will allow us to do that.
I think that's such an incredible answer. Thank you for that. And then the related question is, what is a overvalued topic that we probably talk too much about?
Yeah, I think calorie counting, right? I think the calorie counting has to be the most overvalued topic that we see in health. You eating just one bag of chips for the whole day is actually a lot more unhealthy than eating large amounts of like vegetables and fruits. And so I think we need to start to see a change from pushing away from calories. I think I see a lot of, especially like fitness influencers talk about, just taking large amounts of, changing up your calorie like intake. And I don't think it's necessarily focused on caloric intake. It's more so on the whole picture, like what types of food that you're consuming more than just a pure focus on calories. And we're starting to see a lot of debunking happening on the US standard of sort of like the 2,000 calorie diet. And we're starting to see that that's not accurate. And so I think that's going to have to change. And I think that's overdone on social media.
Yeah, no, even on the glucose monitors, I remember I had an ice cream and it was like this super unhealthy ice cream, and I didn't see much of a spike at all. So I think you have to be like very discerning, even with some of these, like where you're getting your data from, not just counting. But
yeah, for sure. I think with the new labels, I think we're going to start to see like that change. I think Mexico is making a push as well to change like the nutrition labeling.
And the last question as part of our lightning round is kind of what practices that you've incorporated into your lifestyle to kind of maintain your health.
Yeah, for sure. I think one thing that Mexicans do beautifully, and I think that they should keep doing, is the community aspect, right? You can have a fiesta, you can talk to your friends, you can go to your neighbors. That is the part that is incredibly valuable from my time in Mexico that I learned. In the US, people don't do that. They're more socially isolated. And so I do think that's the one thing that Mexican Americans really Mexican Americans and Mexicans should be able to really, emphasize on is having that social connection, because it does help you having a whole team behind you, like your parents and your grandfathers and everyone sort of supporting your healthcare journey. I think that's very important. And just having, your friends to talk about things, because mental health does play a big role in your health in general. And then another thing is yoga and meditation. I think yoga and meditation are incredible to sort of take a break from our overly sort of like digitalized world. And then just making sure that you're making active choices over the long term on food. I'm not saying that, I don't think I'm perfect. I don't think every day I'm like, oh, I can't eat this or I can't eat that, but making sure that I'm rewarding myself and being able to eat certain foods that I want to, but at the same time, making sure that, I'm taking adequate steps to keep it balanced, because I don't want to be forever banned from, like you said, like I love ice cream. I love dulce de leche, like all of these things. I don't want to be banned from them permanently, right? I would rather have it like once every few weeks instead of never being able to eat it anymore. And so those are the small changes.
Amazing. I think that's a great note to close on. Rima, thank you so much. Is there anything that we missed today? Is there anything that you'd like to add or share with our audience?
No, this is great. I'm excited to see what everyone's sort of like reactions are. And yeah, then in the comments, maybe we can get some sort of feedback on what people want to hear about their healthcare.
Amazing. And also thank you so much for supporting us, for supporting Somos over this year. And yeah, it's been lovely chatting with you. We'll have to have you on for podcast number 2 when you've tried Somos. And yeah, thank you so much for chatting with us today.
Yeah, for sure.